Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Doctor, is the sports clinic seeing more teenage girls come in for treatment?
We're definitely seeing more teenage girls than we used to. It hasn't changed that much recently, but over the last 15, 20 years, there's definitely been an uptick in girls' injuries compared to the increase in boys. Boys' injuries have stayed kind of steady, but the female injuries, especially with certain injuries like kneecap instability, patella instability, and ACL tears especially, has gone up dramatically.
What is the cause of the uptick in girls' knee injuries?
Well, there's definitely a lot more girls playing sports than there used to be. That's definitely been shown since the Title IX went into effect many years ago. And now we're into almost a second generation of kids going through that. And so nowadays it's just as common for young girls to play sports as young guys. And so with that, we see an increase in injuries in general, as we would with the boys when they play year-round sports. But certain injury patterns like ACL injuries and kneecap instability are definitely more common in girls than in guys.
Are girls' knees naturally weaker?
We don't know that answer. It's been looked at extensively with research with different anatomical issues, hormonal issues, other things that are a little different with the anatomy with females compared to males. And there hasn't been any one thing that's been proven to why. The one thing that has been proven is girls do tend to land a little bit differently when they come down from jumps. And that's an interesting thing that can be worked on to try to avoid ACL injuries with prevention programs.
Are athletes in certain sports more vulnerable?
It's usually injuries with sports that involve twisting, turning, pivoting, quick stops and starts compared to straight ahead sports. So track and running and rowing, those type of things, you don't see these injuries as much, but you do see the higher injury in knees with girls compared to guys that play the same sports. We see problems and injuries in all types of activities and as well as other alternative type sports like cheering. We've definitely seen injuries with that, especially the higher level cheering that involve jumping, spinning, falling from heights with jumps. There's definitely injuries involved with that. Dancing, you see a lot of repetitive injuries because dancers tend to do their activity many hours a week, more than a lot of other athletes. So we can see injuries related to oftentimes repetition with that.
Is surgery the only option for knee injuries?
Hopefully you can avoid surgery, and the way to do that is through the prevention programs that can be worked with through schools or athletic trainers or physical therapists to work on conditioning and muscle training and landing and positioning training and balance issues. That's the best prevention aspects. If someone unfortunately goes on to tear their ACL, then lots of times they will need to have surgery to correct the problem, and hopefully they can get back to their full sports activities.
Is there a set time for recovery from knee surgery?
Unfortunately, things take a long time to heal with knee injuries, and most athletes take 9 months to a year to fully get back to full sports activities after an ACL type reconstruction or a kneecap stabilization procedure. It might be a little shorter with that procedure, but ACLs, we used to say 6 months, but we saw a higher failure rate. So it's been prolonged now, and it's more like 9 months to a year for full sports activities.
Are there warning signs a girl can look for?
Well, there's definitely warning signs with overuse type injuries. That's usually just pain. Pain is coming, and it's not going away with a little bit of rest or maybe taking a little bit of medication, like an anti-inflammatory medication. Any pain that persists and doesn't go away is concerning. Any swelling of a joint is concerning. And those are reasons why you should get evaluated by a professional, either your primary care doctor or a sports medicine type physician.
Can playing only one sport make an injury more likely?
Their muscles sometimes need a little bit of break or a little bit of cross training, a little bit of a different activity to work on different muscles for your balance and strength. In today's day and age, a lot of sports have become very specialized and year-round, and that's really not the best thing for an athlete's body.